Running an ambulatory practice today isn't simple. Leaders are balancing patient care, staffing pressures, financial performance, and rapidly changing technology all at once.
Welcome to In Practice, a podcast focused on the latest in ambulatory care, what works, and what leaders need to know to help their practices thrive. Hi, I'm Dr. Bob Murray, the Chief Medical Officer at NextGen Healthcare, and this is In Practice, a podcast where health tech leaders, clinicians, and practice administrators discuss challenges that ambulatory healthcare practices face every day and strategies to overcome those challenges. May is Mental Health Awareness Month. It's a time to recognize the importance of mental health and the people delivering care in communities across the country. But for behavioral health organizations, awareness is only part of the conversation, and demand is rising, staffing remains difficult, reimbursement is complex, and leaders are under pressure to expand access while still supporting their teams. So perhaps now more than ever, behavioral health cannot sit in a silo. It needs to be part of a conversation, a connected care model that helps teams see and support the full patient. Now, today I'm joined by Javier Favela. He's the Vice President of Market and Segment Strategy at NextGen Healthcare. And Javi, as we call him, works closely with behavioral health organizations and understands the operational, financial, and clinical pressures shaping this part of healthcare. And we also have with us Erin Page. She is a solutions engineer at NextGen Healthcare, but she's also a licensed associate counselor. And Erin has nearly 15 years of experience in the mental and behavioral health space. So Javi and Erin, welcome to the show. All right, let's start kind of broad. I'd love to hear from both of you. What are the biggest pressures that you are hearing that behavioral health organizations are telling you about right now?
So, Dr. Murray, I think what we're seeing in behavioral health is, while complex, the problem's pretty straightforward. Demand is rising faster than systems can ultimately respond. And I think that it's much bigger than an access problem. It's workforce shortages, as you mentioned, reimbursement complexity, higher patient acuity, and then overall operational strain, all kind of converging at once. And now you can add policy pressure to that list. You have HR 1, also known as the One Big Beautiful Bill. Organizations are looking at Medicaid cuts and tighter eligibility redetermination requirements. And this is really creating instability for patients and even more administrative burden for the teams ultimately trying to keep their patients covered. And I think organizations are really getting ahead of not just trying to add capacity. We can't solve the problem by adding more staff. You also have a workforce problem, but ultimately rethinking their operational model. And I think they're looking at how care is delivered today, how teams need to better coordinate because it's an extremely bifurcated system, and how information ultimately moves across their organization and across other organizations. We have many examples with NextGen, kind of looking at Sam Rogers as a strong example. By moving from what is really a bifurcated system, disconnected systems, multiple EHRs, by moving to a unified platform across medical, dental, behavioral, and social, they've ultimately created a single source of truth and have made real coordination possible. And so we're seeing a big shift in leaders focusing on how to rethink the delivering model operationally, clinically, and financially to address those pressures.
Yeah, I mean, Javi, I think it's a great point that behavioral health organizations are not likely to be able to get enough staff to staff their way into providing access. They've got to rethink how they do things, and I think from my experience, and Erin, I'm curious to hear yours, but from my standpoint as a family doctor, so a bit on the outside of behavioral health, but still aware. It seems like just an inordinate amount of clinician and staff time is spent not actually providing care. I think it's even a higher fraction of time than physical health. So, Aaron, in your experience, and you're talking with our clients, I don't know if you've seen that as well, or if you have other thoughts on some of the challenges that BH organizations are facing.
Yeah, I think with technology, with social media, and all sorts of platforms these days, the conversation about mental health has become more common. So people are talking about it more, which also means that folks are seeking care more. So, as Javi mentioned already, the influx of the need has increased, but the staff shortages still are there. In my experience, in when I was working through my internship, I was grateful that my supervisor talked to me about compassion fatigue and how working in the mental health field can cause that fatigue where you just lose the ability to have compassion after a while because you're dealing with trauma and all these things. And the way to combat that is to separate from work, to have time with family, to go do your own counseling, to do things that matter to you in the evenings and the weekends. But we're seeing folks now that are in this field, they are doing documentation all hours of the night. They're completing documentation on the weekend. And so not only are they burning out from the time it takes to document, but it also burns out from not being able to treat their own compassion fatigue, their own struggles of carrying the weight of the trauma of others. And so all of that compiles, and then we have folks leaving, and then they leave their caseload to those remaining, and then they take on a higher caseload, and it's just a cyclical pattern. And more staff won't necessarily help it. It's the process of getting that documentation and how is that whole process completed that can take the load off those that are continuing to do the job.
I think it's really important to note that what Aaron is describing, that pressure, it ultimately turns into organizational dysfunction. And teams are spending time pecking and hunting technology for information instead of acting on it. And that ultimately gets felt by the patient. And then leaders lose sight of where the bottlenecks are happening, where they really are. And so I think that's why it's important that we're kind of digging underneath the full delivery model and the technology around it, because ultimately it's impacting outcomes and it's impacting patient care.
So, but thinking about that, Javi, just tell me more. Like, how can healthcare tech, help with both, imagining or helping behavioral health organizations, reimagine workflow, not just trying to staff themselves up, and then also help Aaron's problem where the clinicians themselves don't even have time to take care of themselves because of the documentation and other burdens that they're facing. How can tech help with that? Let's get into that.
Yeah, I think leaders should ask a much bigger question on whether, because this is, we have to think of the full systems that are in place, right? Third party, the EHR. But ultimately, our goal is to achieve better outcomes. And we tech can help if you're focusing on the right areas. Where's the highest friction clinically, operationally, financially, right? And a lot of times we're seeing people look at, what's the next shiny object, what's the latest tech out, but not focusing on where the fragmentation is occurring and where the highest friction is, right? So that's kind of number one. And ultimately, the focus should be, you know, kind of where NextGen's moving. Well, how can we enable the data inputs to provide better context, to provide better information, and to take action on that information? And I think technology is really critical to ultimately improve access, to support coordination, to drive performance, and to scale that model over time. And I think a lot of leaders are shifting the focus on the tech side of the house, whether that's AI, augmented intelligence, wraparound technologies, or within their own core EHR platform to solve some of those problems.
So let's go there. I mean, you said the big bad words, AI. I mean, I'd love your both of your perspectives on, what is AI going to bring to behavioral health and how's it going to help? And then what should leaders maybe watch out for? Aaron, you want to give us your thoughts?
Yeah, I mean, I think a huge piece from my own experience and just with talking with others is the amount of time saved not sitting at your computer typing. is kind of the obvious one, but there's another aspect that I want to call out,
But
and
that would
that's
be, I'm
the
sorry, Aaron, but that would be for like an AI scribe kind of thing.
correct.
Like it listens to your interaction with the client and then like helps you with the draft of the note.
Yes. Um, so one, that takes away the burden of having to remember everything that was said. Two, it saves you the time typing. And three, the connection with those that we serve is super important. So removing that computer screen, allowing that connection to happen, is it just all of those things take the load off both for those getting care and for those providing it. And then even if I have to review it, which you should, review your notes after, even if AI wrote it for you, on that time of just reviewing the note, maybe making a couple changes is so much faster. Your note's done, you get to go home at the end of the day and spend time with your family or do your self-care that you need to do.
That's great. Do you think that behavioral health, in terms of like the adoption of the AI scribes, is behind physical health, ahead of physical health? Where are we?
I think behavioral health has unique challenges for sure, but I think we're making strides and bounds with it, because you do have to make sure that it's safe for those that are partaking in it. So when I have a client sitting across from me, I want them to know that it's not using their information in some weird way, or we want it to be HIPAA secure, of course, but also something that we can communicate to folks that this is secure. It's not saving your information somewhere. I think those are important conversations to have when looking at AI, because we already have too many barriers getting folks in the door in the first place. So we don't want AI to add to that. And so if the AI is securely saved, if it's an addition and it allows you then to have that face to face, you're also going to retain those that you work with because they're going to get more of a connection versus someone typing at a computer the whole time that they're talking.
What about you, Javi, former CFO of a behavioral health organization? Where is AI going to help or maybe not help you?
Yeah, and let's just say AI is the buzz in healthcare and in behavioral health. I'm joining you here today from New Orleans. I'm at Mental Health Corporations of America. AI everywhere, AI in the talk tracks, in the sessions. We were at the National Council for Mental Health Wellbeing in April. Same thing. AI was the buzz. And I think AI, or augmented intelligence, right, has real potential in behavioral health, but only if we stay practical about where the value comes from. And so the value is not, it's certainly hyped up, but it's really should focus on reducing the documentation burden, identifying gaps in care faster, surfacing useful insights and being able to take action on that, and then ultimately helping the provider make better informed decisions about the people they take care of. And so in a field, particularly in behavioral health, where staff are stretched so thin and coordination in a holistic approach to care is super complex, that kind of support can be meaningful. But AI is really only as strong as the data environment. And I think that's really important because if the data is fragmented in your EHR, it's incomplete or disconnected across the various settings or programs or services, the output will be very limited. And that's why we talk so much about an integrated platform and why that matters so much. It ultimately creates the foundation as you shift into leveraging augmented intelligence or AI for better insights, for better outcomes. But we need to make sure that it's reliable and the data is really critical. And focusing on high friction points is super critical. So when we think about AI in this space, I think it's less about the novelty and more about the execution from my perspective.
Yeah, I mean, I like that healthcare and behavioral health leaders considering AI, as you said, should focus on the value, right? It's not AI for its own sake. It's not the whiz bang this, that, or the other. But I do think that there are a number of very compelling use cases, as they're called, for AI in behavioral health. I do think that AI Scribe is one of them. I also like your point that that the AI having access to the data, or even more fundamentally, for the data being organized in a way that is AI friendly, is really important, right? And it's, I think it's one of the reasons that it's a little bit hard to bolt on kind of an AI, solution in behavioral health, because only having access to the conversation that's happening is a very tiny part of the therapeutic picture at any point in time. And so the system really needs access to more in order to properly, interpret what it's hearing, so to speak, and help the clinician, turn that into a note.
Context matters, right?
Yeah,
And
exactly.
yeah,
Beyond AI Scribe, though, I mean, billing in behavioral health, right, is only getting ever more complicated. Everything from checking patients, eligibility for services, and then all of the variations and certification requirements and all kinds of stuff. So, how should leaders in behavioral health organizations kind of approach that complexity? Is it getting better or worse over time? And what kinds of things can they do on that end of things?
yeah. As a former CFO, I can tell you that revenue cycle in behavioral health is more than just a finance issue. It's an operational challenge. It's a compliance challenge, and in many markets that we work in, there's policy complexity attached to it. And so when you look at behavioral health, there's complexity in the payer variation, managed care organization, the authorization process. You get even more complex with things like state reporting if you're heavily Medicaid funded. A lot of the complexity is not just federal, it is driven down to the state. And in some states, it's driven down to the county level. And in places like New York, it's driven down to the city level, right? And so technology is going to be absolutely critical. And AI is going to be hot in revenue cycle because it does help solve a lot of these complexities, whether that's AI for a rules engine, helping manage denials, denial predictions. I think I think technology is going to be absolutely critical. Um, the groups that we see, the complexity is amplified with groups like who are certified community behavioral health clinics, who may also have a federally qualified health center designation. And the ultimate goal really is to is get clean claims out the door and financial sustainability models that ultimately support the organization's vision and mission. And I think technology is going to play an absolute critical role. And we're seeing more and more advancement in the RCM capabilities, particularly around AI and how organizations can leverage AI to improve and ultimately create financial sustainability for their organization.
And the billing component for behavioral health isn't just the code, the time. Um, so many times on calls I hear, oh, we got declined because, the note didn't match the code, the description didn't in there. They didn't use this phrase, they didn't talk about this modality, they didn't meet this requirement within the body of the note. So still going back to that clinical piece, having a tool that can help you remember all of those things that are different per payer, per state, per policy, there's all these things that burned out clinicians don't have time to remember all of those little things they need to add. I was a trainer previously, and even just training folks to help them remember, it's a lot. It's hard. So just taking again more of that mental load off is going to make those claims more successful as well, because the note's going to verify and meet the requirements for the codes that are submitted.
I think to that point, I will challenge the audience who listens to this, right? Any CFO, chief operating officer, we have to think, revenue cycle is just not about processing these transactions more efficiently. It's about managing what is a very high variable environment. How can you do that without overwhelming the organization operationally and without having to add more staff?
Exactly. All right. So maybe as a kind of a wrap-up question, if you were advising a behavioral health leader feeling overwhelmed by staffing pressure and operational complexity and need to provide access and demand, really, really practically, what maybe 1, 2, 3 steps would you recommend them doing first to try to, help them along the way?
If I had to simplify the advice, I'd focus on 3 things. 1, reduce fragmentation. 2, invest in visibility. And 3, strengthen the care coordination of the program and service delivery within your ecosystem. I think those 3 priorities create leverage across almost every challenge in behavioral health that leaders are facing. Reducing fragmentation helps teams spend less time navigating systems and more time delivering care. That should be priority number 1. Visibility helps leaders spot pressure points earlier and to act on those. So to act proactively instead of reacting to those pressure points. And stronger care coordination improves the continuity for patients while reducing kind of the missed opportunities, missed follow-up, and disconnected services.
Yeah, I appreciate you saying all that. All that connection is super important across the board. And I think because AI is so flashy, and I think just being careful to not get caught up in the flash of it, and really make sure that those pieces that you're looking at understand the actually true value and not just the catchiness of the AI catchphrase. That the importance of the why behind it, the value that it brings to everyone, and just being able to get a full picture of the agency, but also those that we serve.
My experience, Dr. Murray, is that organizations that have focused on these 3 key pillars, the organizations that move fast are the ones and that are growing are the ones that have treated these priorities as part of one operational strategy.
Interesting. Very, very good food for thought. But Javi, thank you very much. Erin, thank you very much for joining us. I think it's been a great conversation, a good topic. Any parting words? Is it going to get better?
It is.
I'll let Erin go first.
Yeah, I mean, I have a lot of hope that in a very important field that we've got some hope to make things easier and make things better and get people the care that they need. And then I think as that happens, we can continue to break stigma. People will realize that care is within their reach. People will realize that that the person is there on the other side and not just the computer. And I think it's going to help our communities in a lot of ways. So I have a lot of hope.
Yeah, I've been in the behavioral health space now. This is my 26th year, and I think behavioral health is at an inflection point. The pressure's real, but good strategy, good leaders, they see the opportunity. There's opportunity here.
Wonderful. All right. Thank you again for joining the show. And listeners, we appreciate you making time to join us as well. This is, again, In Practice. So be sure to subscribe to the podcast on Apple Podcast or Spotify, and you will never miss an episode. Thanks again.